Well, when COVID-19 hit, healthcare companies were inundated with customer calls with questions they were really not fully prepared to answer. Indianapolis-based Authenticx is not letting that dynamic play out again as we enter what could be a challenging flu season. The company's compiled data on what health consumers are most concerned about and is providing that information to help healthcare providers give the best care they can. Here's more in the business of health. Barbara Lewis filling in for Kylie Valletta. Barb.
Gary, thank you. Between COVID and the seasonal flu, giving people the information that they need and they want will be key. So joining me is Amy Brown. She is the CEO of Authenticx. Amy, welcome.
Thank you. Great to be here.
So you collected data from 45,000 people who are really kind of helping us all understand what people really want to know about this upcoming flu season because we're still in the middle of a pandemic. So what were the responses? What are people concerned about?
Yeah, so our platform and our business is designed to listen to what is top of mind to customers when they call in to a customer service contact center. And we specifically listen to calls that come into healthcare companies. So you can think about pharmacies, health insurance companies, the doctor's office. Those are the types of interactions that we are listening to. And the things that are top of mind of those customers are things like, how does my normal behavior around protecting myself for flu, how does that look different than now that we have the pandemic going on? We learned from listening to customers over the last 6 months that some of their top questions were around how to protect themselves from actually contracting the virus, but also how does their risk for coronavirus change depending on their particular medication regimen that they might be on for their routine medical care. And so as we approach the flu season, we are hearing customers really wonder if they need to treat or behave differently than they have in the past about this flu season, just because of what we're all dealing with COVID.
Okay, so that really sounds like the risks, but there's also, there's always so many other concerns when it comes to healthcare, including trying to figure out if you can get your prescriptions on time and payment. So talk a little bit about how that information is, or how concerned people are about that right now.
Right. So one of the biggest things we saw change after March, after the pandemic hit, was we saw more and more customers who normally could afford their medical bills start to have challenges due to the economic factors that happened with regard to the pandemic. And so we have many more customers asking for businesses to offer flexible payment plans or to allow for some grace period of paying their bills. So what we're hearing customers say is, hey, company, I want and need to still do business with you, and yet I need you to meet me halfway because life today looks very different for me economically than it did a few months ago. So that's number one, is customers are asking for companies to work with them. The other major concern that you mentioned, Barb, is supply chain related concerns. So we're hearing a lot of questions where customers are calling in to customer service and saying, hey, flu season's coming up. I have this medication that I've been taking for the last 5 years, but due to demand for vaccine or due to demand for the flu shot, is there any risk to me not being able to get my routine medications on time? And I know that with some of the challenges that we heard in March and April with supply chain concerns, with mail delivery, such a demand on that system, that there were some real delays in folks being able to get access to the medications they need. And so that very much is still top of mind. And they're asking companies, hey, do you have supply and do you have your supply chain figured out?
I'm trying to picture all these calls, and I know when I make a call, I'm long-winded and I'm telling them everything. So how do you take the information that you're getting from these calls and turn them into something that your clients can really act on?
Right. So So Barb, you mentioned something that we can all relate to, and that is when we call any kind of customer service line, we hear when we start the call a kind of a voice saying this call may be recorded and monitored. And what happens though is companies often use those call recordings for a very limited purpose. They listen really for that call center agent and how effectively do they do at handling the customer's need. But what tends to get ignored from those call recordings is the insights that customers are giving the company without being asked. They're telling you what's top of mind, what their concerns are, what they wish the company would provide to them. And so when we take in those data sources in the tens of thousands, hundreds of thousands into our platform, we're able to really use natural language processing, AI, as well as deeper analytics in listening to those voices to help kind of put together key themes for leaders to understand, okay, of all these conversations, what are the top things that are top of mind that we can now as leaders take action on because we get what they need?
Okay, so it sounds like you really just give them, your clients, exactly what they need, and then it's up to them to say, this is how we're going to answer those questions and provide great customer service.
Well, our platform is designed to actually point the direction. So we surface themes through our reporting platform that helps leaders know, oh, okay, this is the problem I need to go target. Because it has to be actionable, right? Just keywords and understanding exactly what people are saying doesn't give enough context to know what actions to take. So we really work hard at Authenticx to give leaders something that they can go take action from.
All right. Well, Amy, congratulations on a wonderful business, and thank you for taking the time to talk with me.
You're welcome. Thank you. Stay healthy out there.
All right. Gary, back to you.